Hey, Brandon Dilbeck, SpectrumForMed.com, and this is the Dynatron 525 3-channel Stim unit from Dynatronics. The Dynatron 525 is to replace the previous 550 model. They've brought over all the same features and functionality, they've just brought the design up to the modern era. They've come out with a nice clean white case, still on the same solid steel subframe, and they've added a 4.5-inch LCD screen display. This gives you a nice place to view and see everything. With the 525, you're going to get the Dynatron 2-year manufacturer warranty, but Spectrum Medical is going to be here for the future, so if you ever have any problems in the future, you give us a call and we'll get you taken care of. So on the back of the unit, we're going to have our power supply, on-off switch, an SD card slot for software upgrades, and a port to add on an optional battery pack in case you want to take this unit on the road. Back to the front, you're going to have your same 3 channels, 2 interferential channels, 1 high volt channel. Yes, you can run all 3 at the same time. So let's show you how all these features work. Let's begin with interferential. To set up interferential, first tap IFC, and then you're going to see your menu selections displayed across the bottom of the display. You can see here channels 1 and 2 are active. Also, you're going to be able to set your time and choose your frequency. We're going to have frequency options of high, which is 80 to 150 pulses per second, low, which is 1 to 10 pulses per second, alternating, which is going to do 10 seconds of high followed by 10 seconds of low, consec, which is actually going to take the treatment time, divide it in half, and do the first half of a high treatment and the second half in a low treatment, and then optionally you have a fixed frequency. For this demonstration, we're going to go with high. Next, we're going to have target, sweep, or static. Now, target is a very nice feature when treating joints and knees. We'll recap that just in a moment. Let's move on to sweep. Sweep is probably going to be your most common setting, and that's going to decrease the intensity of the red pads by 10% and allow the black pads to overtake that area. It gives a sweeping or moving motion in the patient. And the more movement you put in your electrical stim, the less acclimation the patient's going to experience with the intensity. So you're not going to have to come back in the room and increase the intensity midway through the treatment. Once you've made your selections, increase your intensity to patient's preference and press start. Now, interferential is probably one of the more popular waveforms. Behind that is probably Premod. So let's go ahead and show you how to set up Premod. To begin, choose Premod. Now, Premod is actually pre-mixed interferential, so you're only going to need 1 lead wire, 2 pads in an area. So we're going to grab channel 1 as you see here. You're going to have a lot of the same settings, set your time and also your frequency, bring up your intensity, and press start. Now we still have that second channel open, so we can go back and set up a second Premod channel. To do that, press Premod a second time, and you can see channel 1 turned yellow, meaning it's running in the background. Channel 2 is now green, so that's our active lead. We have the same settings of frequency, time, increase our intensity, and press start. You're now running 2 independent channels of interferential. Now we could come back and set up a third high volt channel, but you would have to purchase a third lead wire, which is available at SpectrumForMed.com. I happen to have one here. Okay, with the third lead wire plugged into our high volt channel, we can allow our 2 Premod channels to continue running, and now come back and set up our high volt. To do so, choose high volt. And you can see it defaults to the high volt channel. It's now green. Choose our frequency, choose our polarity, positive, negative, or bipolar, increase your intensity, and press start. I'm going to stop all of this and now show you all how to set up Russian and biphasics. Russian and biphasics are both very similar waveforms of electrical stim. They're both typically used to treat muscle re-education. So to set up biphasics, choose biphasics and then answer the selections you have at the bottom of your screen. Do you want normal, co-contracting, or reciprocating? What do you want your constant and rest cycles to be? And set your ramp. Make your selections, increase your intensity, and press start. Now to set up Russian, it's very similar to Biphasic's. Choose Russian. You have a lot of your same settings as far as reciprocating or contracting, your hold and rest cycles, and your ramp cycles. Make your selections, increase your intensity, and press start. Okay, the last thing I'd like to tell you about is the target feature associated with interferential current. You're going to need your 4 pads of interferential, and it's most commonly used when treating a joint like a knee or shoulder. So you're going to put your 4 pads on your patient, crisscross pattern of red and black. You're going to bring up the intensity and press start. The patient's going to say, the stim feels great, but I feel the focus of the stim off center of my point of pain. You could stop the treatment, move the pads, and begin again, or toggle over to your target feature and actually drag that electrical stim focus right on top of that patient's point of pain. And here's how you do it. You set up your interferential current, you bring up your intensity, and you have your treatment going. Here, you toggle over to the target feature, and all you have to do is drag your finger on this mouse pad, very similar to like a mouse pad on your laptop, and the patient's going to feel that stim move. Once you find where you want it to be, just remove your finger from the trackpad and it's going to stay put. In the box with the 525 is 2 lead wires, your power cord, your owner's manual on CD, and a little accessory pack of stim pads and things to get you started. The 525 is their 3-channel stim unit, and it's predominantly used for treating 1 patient at a time. You can take a step up to the 625, which is going to be a 5-channel stim unit, and it's great for treating 2 patients at the same time. Or go to their 825, which is going to be 3 channels of stim with ultrasound, or their grandest unit, which is the 925 with 5 channels of stim and ultrasound, in which all of that can be running at the same time. We have reviews, videos on our website, and we'd love to hear your feedback. Please visit us online at spectrum4med.com.
To order online, view product information, or obtain service, visit spectrum4med.com.